Hello everyone, my name is Ilse Beaufort and I'm a PhD candidate in the gastroenterology department in St. Antonius Hospital and University Medical Center Utrecht in the Netherlands. On behalf of all co-authors, I would like to thank Endoscopic for the opportunity to briefly discuss our recently published article entitled Endoscopic submucosal dissection for early esophageal squamous cell carcinoma, long-term results from aWestern cohort. ESD is established as first-choice treatment for early esophageal squamous cell carcinoma worldwide. However, most data regarding outcomes for this particular indication are derived from Asian series. And we therefore aim to investigate the long-term outcomes of ESD for patients with early esophageal squamous cell carcinoma in aWestern cohort. In our retrospective cohort study, we included patients with early esophageal squamous cell carcinoma amenable for ESD in 4 tertiary referral hospitals in the Netherlands between 2012 and 2017. The decision for and the choice of additional treatment following ESD was made on a per-patient basis after discussion in a multidisciplinary meeting, and it mainly depended on final histopathological diagnosis, with also taking into account the patient's age, comorbidities, and preference. Short-term outcomes of our study included a technical success rate and a curative resection rate, which was defined as an en bloc radical resection with histology no more advanced than the superficial submucosal layer, with good differentiation and in the absence of lymphovascular invasion. Long-term outcomes included overall and esophageal cancer-specific survival. Our cohort consisted of 68 patients with a median tumor size of 3 cm and a median circumferential extent of 50%. ESD was technically successful in 97% of patients. Based on the histopathological evaluation, a curative resection was achieved in 52% of our cohort. Among the patients with a non-curative resection, 47% of patients underwent additional treatment, receiving mostly adjuvant surgery or chemoradiation therapy. Endoscopic surveillance was preferred in the other 53% of patients with a non-curative resection based on severe comorbidities or patient preference. During a median follow-up of 66 months, 31 patients died, of which the minority was related to esophageal cancer. The 5-year overall and cancer-specific survival probabilities were 62% and 86%, meaning that patients were more at risk of dying from other causes than esophageal cancer. No statistically significant difference was seen for overall and cancer-specific survival between patients with a curative resection and a non-curative resection. So, in this Western cohort with long-term follow-up, the efficacy of ESD for early esophageal squamous cell carcinoma was confirmed, although the rate of non-curative resections was substantial. And irrespective of non-curative or curative resections, the long-term prognosis of these patients was limited, mainly due to unrelated comorbidities. And therefore we think that the potential benefit of additional treatment after a non-curative resection should be carefully balanced against the individual risk of dying from other causes than esophageal cancer. Thank you very much for your attention.